Good afternoon. My name is Karina Garza and I am going to talk to you about coronavirus. Coronavirus is the new pandemic that everybody is talking about. So first, let's define what it is coronavirus. Well, coronaviruses are an extensive family of viruses that can cause respiratory infections that can range from the common cold to most serious illnesses such like Middle East Respiratory Syndrome, better known as MERS, or SARS. Coronavirus is the most recently discovered type of coronavirus, and this new virus was unknown before the outbreak in Wuhan, China in December 2019. And it's called COVID-19 because it has the C and the O from corona, the V and I for virus, and the D from disease. And 19 is the year when the virus was spread. So what are the symptoms of this new disease? Well, you can have fever, tiredness, dry cough, but some patients may experience pain, nasal congestion, runny nose, sore throat, and even diarrhea. It's worth saying that some people don't have any of these symptoms, they don't feel anything, but still carry the virus, so they can spread it to more people without knowing it. And how is it spread? Well, you can spread it through the air by coughing and sneezing. You can spread it by close personal contact, such like touching or shaking hands, and touching a surface with the virus on it, and then touching your mouth, your nose, or your eyes. So how is it prevented? Well, the World Health Organization recommends to wash your hands often with just water and soap, it's enough. Also avoid touching your eyes, mouth, and nose with unwashed hands, and also avoid contact with sick people. And even if they don't seem sick, please avoid crowds or close personal contact. And the most important thing is that during this quarantine, please stay home, because there are people that really need medical assistance. And if you stay home, you are minimizing the number of infections and preventing the collapse of the health system in Mexico. So that brings us to the next point, that is, who runs the risk of developing a more serious illness? Well, older people or people with pre-existing medical conditions, for example, diabetes or high blood pressure, appear to develop severe cases of this disease more often than others. So please think about them. And the most common question, should I wear a mask to protect myself? Well, if you don't present symptoms of coronavirus, or if you are not taking care of a person with this disease, it is not necessary to wear a mask. So in conclusion, the treatment is usually adapted according to the severity of the patient. Since there are cases in which severe pneumonia occurs, and there are other cases when the manifestations are mild.